Well, welcome to Lessons from the Field. This is a series of interviews that we do with a diverse array of guests, all who have a common thread, and that is a passion for pharmacy and pharmaceutical sciences. And today we're featuring Jennifer Samp, who is a three-time graduate of the College of Pharmacy. She got her PharmD degree in 2011, and then a master's degree from our Department of Pharmacy Systems, Outcomes, and Policy, and then a PhD from that same department. So the master's in 2012 and PhD in 2017. Dr. Samp is now the Director of Medical Affairs for the Oncology group at Daiichi Sankyo. I'll be asking Jen a series of questions that hopefully will gain some valuable insight on her career and her experiences, and how her experience may benefit our students, alumni, and friends. So why don't we go ahead and get started. Jen, if you could just walk us through, like, the, briefly your career, either starting at UIC or before, and then what you've been doing up till now.
Yeah, so I actually got my bachelor's degree in speech communications before I went to the University of Illinois. Pharmacy school. I always knew I wanted to go to pharmacy school, but I thought that a degree in communications would be helpful for kind of any career I would pursue afterward. After pharmacy school, I knew I wanted something different, and we could probably talk a little bit, Glenn, about my experiences in pharmacy school that led me to want to do something. But I pursued a fellowship in health economics and outcomes research. It was a fellowship that was done with the University of Illinois, Pharmacy Systems and Outcomes and Policy Group, or PSOP group, and then Takeda Pharmaceuticals. So I spent the first year of that fellowship getting my master's, and then the second year of the fellowship at Takeda in their outcomes research group. During the fellowship, after I got my master's, I kind of continued to take classes towards my PhD, and decided that I did want to continue on and complete that PhD. But I was also really anxious to kind of get into the workforce at that point, because I had been in school for a very long time. So I decided to do the PhD on really a part-time basis while I was working at a company called AbbVie, which is just kind of north of Chicago. So I worked in AbbVie's health economics and outcomes research department while I was pursuing that PhD in pharmacoepidemiology and pharmacoeconomics. I spent a few years at AbbVie working in the hepatitis C franchise. I did global work there, and then kind of transitioned to US work. I also kind of transitioned to their oncology portfolio at AbbVie. And that was at that time then I had been doing health economics research for maybe about 5 years or so after leaving the university. I did a lot of different types of health economic studies, and an opportunity came up for me to kind of transition to a broader medical strategy type role. So at that time, I was really interested in medical affairs. I enjoyed the opportunity to kind of make a broader impact on the organization, kind of more broadly than health economics research. So I did accept a role in the medical affairs department, moving from the health economics department, still in oncology, but then kind of continued to work on the product that I was on previously in a medical strategy type role. And then a couple of years ago, I got the opportunity I was looking at kind of positions on the East Coast and in areas kind of outside of Chicago, and a position at Daiichi Sankyo was open that was on another oncology product. It was in the heme space at AbbVie, and this was in the solid tumor space. So again, I saw this as a great opportunity for me to get experience kind of in the solid tumor space in oncology, again, in another like broader medical strategy type role. And that's kind of where I am.
Great. Well, wow, I do want to ask you some questions. I'll just, maybe we could step back a little bit. I'm curious about the communications degree, and because I don't, you know, many of our students come in with more STEM related bachelor's in chemistry or biology or whatever. How have you found the communications degree to be beneficial for you? Is there pieces of that that really have stuck with you that you find very valuable in your current role or over time?
Yeah, I would say, so, you know, I have to have very specialized knowledge, clinical knowledge and research knowledge to be able to do my job. But it's funny about, I would almost say like about 70% of my job is, you know, communication with people, communication with people who report into me, communication with peers and other departments, communication to leadership upward, to our customers. So that's probably, you know, I've gained a lot of knowledge in my undergrad on that, but it continues to be something I am interested in and that I have to kind of continue to work towards. You know, it's not like you can get a degree and, you know, have that specialized knowledge. You're kind of continuing to evolve and, you know, your communication skills, especially kind of as you rise up within an organization.
Yeah. Yeah, that's great. So a question that we ask just about everybody who participates in this, because it's something that our students really, I think, want to know, and that is, you know, while you kind of describe your broad role, which sounds really fantastic too, by the way, the movement from health outcomes and economics to medical affairs, it shows the, you know, the fact that when you get into industry and develop special expertise, and then you can use that and leverage that to move into other parts of the company and broaden your responsibilities. But what are your day-to-day kind of, or you know, what's a typical week look like? What is the life of Jen Samp in the, you know, in her current position look like?
I think one thing I guess I like about my current position and, you know, working, I guess, in the industry is that every day is really different. Every day I'm kind of tackling different challenges that we're facing. You know, I think what's consistent day to day is there's a lot of meetings, a lot of needing to seek alignment kind of across my team, across the broader team and organization. There has to be a lot of information sharing. So I specialize in medical, but I work really closely with colleagues in marketing and market access and our global teams, in regulatory. So we have to have a lot of conversations and you know, it's bringing the important knowledge to those conversations from a medical perspective, but then also understanding other teams' perspectives as well. And then, you know, making sure we're communicating again, like I said, upward to our leadership, making decisions appropriately, and then also kind of giving people guidance to their roles and, you know, how they could also kind of make sure that they're executing appropriately, they're developing themselves.
Yeah, excellent. Well, thank you. So I guess next, maybe stepping back a little bit, but what experiences influenced you most or kind of helped inform you as you move through this career journey? I know I probably can guess a few, but for our audience, maybe you can just kind of summarize for us where or who, I guess, maybe really influenced you and how you got where you are.
Yeah, I think I did a lot of work in pharmacy school. This is kind of a non-traditional path, I think, for becoming more and more mainstream in the pharmacy school for people to pursue careers in industry. But I think at the time it was a little bit more non-traditional. So I spent a lot of time in pharmacy school. I think talking to people, understanding what other opportunities were available to me with a pharmacy degree. I was involved in a lot of organizations, and it was that involvement in pharmacy organizations that really helped me kind of grow my network at UIC with my other classmates, with people who are kind of further along in the program than me, with other professors. So I was able to see what other people were doing, have a lot of conversations, and also get a lot of input in terms of how I might explore other opportunities. So I did have the opportunity to work at the Drug Information Group while I was at UIC. That kind of opened up more opportunities for me to see other career paths for me. I had an internship at Takeda Pharmaceuticals as well. I did an internship at CVS. So it was kind of all those experiences that really, and talking to people, that really kind of opened up my eyes to what else I could do, and then also how I could go about getting those opportunities to see if it would be something that I would enjoy or not.
Yeah, excellent. Well, and you spent a fair amount of time after you graduated from the PharmD program developing your career, right, with the fellowship and then the master's and PhD, which you did after you started working. But that was a huge investment for you. But I think it's obviously paid off really well.
Yeah, it was something that when I started pharmacy school, I don't think I would have ever told you I would get my master's and my PhD. And even when I was getting my master's, I was really hesitant to say that I was going to get my PhD. But, the PhD just teaches you such a different skill set. It really teaches you kind of how to critically think about stuff that, I almost, I lean just as much on my PhD skills as I do my pharmacy skills.
Oh, good. Well, I guess along that lines, as you've continued to grow and kind of take on new responsibilities in the different companies that you've been with since you graduated, how have you stayed relevant? Like, how have you continued to expand your knowledge and expertise in a way to make you continue to be, somebody that the upper leadership look for when they think about somebody to take on a new role?
Yeah, I think there's like a few different parts to that. As one, kind of staying abreast of what's going on within the pharmaceutical industry. What are key decisions that are being made by FDA, by pharma code of conduct, that type of thing that maybe impact our job right now. And that's really kind of paying attention to news alerts, also just talking to people that are at my organization that have expertise in a lot of that, listening, hearing those. Number two is staying on top of my clinical knowledge. For me, I'm focused on breast cancer specifically, but I am viewed as the medical expert in breast cancer at my company. So a lot of questions come to me, or I have to do a lot of training for our field teams. So that, being responsible for doing trainings for our teams, force us to stay on top of all of that and set aside time to really kind of learn and, look up questions if questions come in. I think the third aspect of that is staying, making sure that I'm further developing my leadership skills. I'm active in the Healthcare Business Women's Association, which is kind of a women's organization kind of for women in healthcare that offers kind of a lot of opportunities for kind of attending developmental courses, networking, et cetera. I also am involved in the mentoring program at my organization. So I do have a mentor at my company who I meet with regularly to kind of talk through problems. But then, I do a lot of research on the side too, in terms of kind of thinking through, understanding kind of how to navigate complex relationships, how to influence appropriately, how to, be a good manager, and, how to communicate upward. All those tough things that we don't learn.
Yeah, right. Wow, that's there's a lot to unpack there, but thank you for that. I mean, you mentioned, your efforts to continue to learn as a manager and leader. Were there things that you could have learned, do you think, in the PharmD program or in school that you wish you had, or should we be teaching students? Is there anything that we're not doing that might have helped you think in your career?
Trying to think. I think I'm forgetting the name of the class. Dr. Lambert's class.
Oh yeah, social behavioral pharmacy, I think it was called at the time, maybe.
Yeah, I found that class
PharmD.
very valuable. Not just in terms of like thinking about, pharmacy, but just kind of communications and interaction
Yeah,
across the board. I took the marketing elective by Dr. Stubbings. That was our class that was just different than the traditional pharmacy classes, but gave a good kind of real world perspective on, how drug companies think about, putting forward their drugs. And, that also kind of gave me a taste for what additional you could do in the pharmaceutical space.
Yeah. Well, good. I guess maybe looking forward into the future, whether it's in pharmaceutical industry in your area, medical affairs, or just generally for graduates of our programs, what do you see as the opportunities, or what would you recommend somebody who's either just starting out or kind of planning their career? Are there particular areas that you think would be something that people should kind of keep their eye on and maybe focus on for their own career? Any thoughts there?
Yeah, well, I think in general, there's a lot of opportunities for pharmacists industry, across a lot of functions: market access, marketing, medical affairs, clinical development, regulatory. Pharmacists are in all of those areas. I think trying to get experience in those areas while in pharmacy school is really good. So whether that's their experientials or APPs or internships, I know this could be hard to get sometimes, but what I tell people too is that just having conversations and really understanding what those roles look like. So meeting with people who are in those fields or areas and getting a better understanding of what that looks like, I think is really important. You don't have to secure an internship to be able to do that. And there's big network at UIC. So there's alumni in all of these areas. And even though you might not know someone individually yourself, you probably know someone who could connect you with people who could explain those roles a little bit better.
Yeah, good. Well, I think as we wrap up, Jen, maybe just other advice that you might have for our students, either related to their careers or people who might be interested in pharmaceutical industry or following in your footsteps in whether it's health outcomes or medical affairs, but or also just like work-life balance or other advice, personal advice. I mean, it sounds like you've obviously been very successful career-wise, and it sounds like you're doing great stuff in terms of advocating for women and mentoring and so forth in your company and outside. And what advice might you have for folks that like I've mentioned?
Yeah, I think, well, I think everyone has to take ownership of their own career and be responsible for their own development. Outside of my company's kind of development program, I put together my own development plan and kind of think through that on my own and set aside time to do that because that's for me. I think also kind of people say networking, but I think, communicating with people, having that strong network, having people you could go talk to when you're having problems or, challenges that you're facing, and being able to get insights on what that, how to navigate that, or even just different perspectives on stuff, I think is really important. And, I think we say networking is something that sounds very formal, but I think it could be very, informal and more kind of like developing those friend networks too in your professional field. I think that's it.
Yeah, I like, I mean, I don't think not enough people think about just going and getting advice from somebody, or kind of, bearing your soul a little bit sometimes to get critical input. I think sometimes we're afraid to do that, but like you say, sometimes that's where you get the best advice. So that's really good. Thank you.
Yeah.
Well, Dr. Samp, this has been fantastic. Thank you so much for taking time to to go through these questions with you. And I know that we'll have a lot of folks that are really interested in hearing this. And hopefully, if you don't mind, for students who might have questions or want to follow up, if we can give them your contact information.
Yeah, of course.
Okay, good. Well, until next time, Jen, I really appreciate it. It's great to see you again, and we'll be in touch.
Awesome. Thanks so much. Great seeing you too, Glenn.